Thinking about getting Botox, lasers, or other skin treatments, one of the biggest questions I get from my followers is how do I find someone I can actually trust with my face? So today, I'm going to walk you through exactly how to find a qualified, skilled, safe cosmetic provider so that you can get the results you want without the regrets. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin and find products and sometimes procedures that work for you. So if you like that type of content, make sure you give this video a thumbs up and you're subscribed to the channel. Not only am I going to give you tips on how to find an excellent cosmetic practitioner to meet your needs, but I'm also going to be going over some red flags to keep an eye out for, so make sure you stick around to the end for those. If you're thinking about having cosmetic work done, and by the way, I don't think anyone needs to have this. I never want anyone to come to this channel and feel like they are pushed to have any type of cosmetic procedure. But if it's something that you're interested in, you should make sure that whoever is going to do it is going to do a good job and to keep you safe. If you're looking for a great, safe cosmetic provider, one of the first things I think you need to do is vet their credentials. In this day and age within the United States, you don't have to be a board-certified plastic surgeon or dermatologist to be a cosmetic provider. There are nurses out there, physician's assistants, even estheticians in some states that can perform cosmetic services. And that's not to say that non-physician practitioners are bad at cosmetic stuff. We will get to that in a second. But if you want someone who has had the most training with the most rigorous standards, a board-certified plastic surgeon or board-certified dermatologist is who you should go to. One question I'll sometimes get is, well, what's the difference between a medical dermatologist or a cosmetic dermatologist? Or Dr. Ellis, you say you're a medical and cosmetic dermatologist. What does that really mean? So when you're going through your dermatology residency, which is after you have completed 4 years of medical school and a year of general medicine internship, you have 3 years of dermatology specific training, you get trained in both medical and cosmetic dermatology. Now, depending on which institution you train at, you may have more or less cosmetic training, but you have to be observed injecting Botox, injecting fillers, performing lasers, and doing it safely and successfully before you're even allowed to graduate. So once you finish your dermatology residency, you are considered a safe cosmetic practitioner. You know the anatomy, you've had your skill set observed, but then you can do more advanced training through fellowships and conferences to really hone your skill set. And this is a little bit in contrast to if someone is a physician assistant or a nurse becoming a cosmetic practitioner, because for nurses and physician's assistants, there is no standardized curriculum through which they learn cosmetics. In fact, you could be an ICU nurse your entire life and then go to a weekend course on Botox and then technically be allowed to inject people. Now, that's not to say you can't have exceptional physician assistant and nurse cosmetic providers. I have worked with many over the years. I have learned from many over the years, but because there isn't that consistent training background, there's just a lot more variability in what skill set they may actually have. Ultimately, because there can be such a variability in training backgrounds and understanding credentials, if you are having any hesitations, know that the gold standard is to see a board-certified physician in an aesthetic specialty like dermatology or plastic surgery. If you've decided that you want to see a board-certified dermatologist, the easiest way to find someone close to you is to use the website aad.org. That has a list of all the board-certified dermatologists in the United States. For me, when I'm trying to find a professional to help me with any aspect of my life, I use credentials to understand if this person is going to be competent. But the thing that I rely on the most is word of mouth and seeing the results with my own eyes. For example, the vast majority of cosmetic patients I have in my practice are through word of mouth. It's because I already treat their friend, their sister, their coworker, and that patient has seen the work with their own eyes and gone, oh, that person looks really good. That aligns with the cosmetic goals that I have for myself, and now I trust that she can achieve that for me too. When it comes to cosmetics, that firsthand exposure of seeing it with your own eyes, there is no substitute for that. I mean, think about how you found your hair person. I went up to someone on the street who had great blonde in my area and was like, who did your hair? Because I could see in real life that those were results I wanted for myself too. Now, seeing things in real life is really in contrast to before and after photos, which I totally understand wanting to look at before and afters to understand if their cosmetic outcomes align with what you want. But the reality is, especially in this day and age with photo editing and light changes and all of that, sometimes cosmetic before and afters are not actually accurate. And also keep in mind, they're like the best of the best that that person produces. They might see thousands of patients in a year and show you 12 amazing before and afters. That's not always representative of their entire body of work. Sometimes I think photos are better for things like plastic surgery, where they can literally show you hundreds and hundreds of photos because it is standard in plastic surgery to take before and after photos. But in dermatology, it's a little bit trickier. One, I find a lot of patients do not want their before and after publicized. They're more private with what cosmetic little tweaks they're having done. Also, in dermatology, sometimes they really are tweaks. They're very small subtleties that might not pick up well in a before and after and are hard to appreciate on a 2D surface. I think a better thing to do is look at the other staff members in the office. A lot of dermatologists, plastic surgeons, nurses, PAs, we treat the people that work in our office. And if you walk in and everyone's looking overdone, or on the contrary, if everyone looks natural and just refreshed, it can give you a sense of what aesthetic they have and what kind of results they deliver. Another thing you'll probably want to do when looking for a good cosmetic practitioner is read online reviews. And the tricky thing about online reviews is people tend to post them if they've had a great experience or a horrible experience, and sometimes there's not a whole lot going on in between. I'll tell you that some of the best plastic surgeons I know, like the ones that treat the celebrities, have some of the most scathing online reviews that I have ever read. So when I'm trying to evaluate someone based on their reviews, which I don't love to do, but if I have to, I usually try to take out the most negative reviews, the most positive ones if they seem like outliers, and just get a general vibe of, yes, is this in general someplace I would like to go, and are reviews mostly positive and somewhere I want to be seen? So in a perfect world, you're getting to see what a practitioner's work looks like in person. You can look to online reviews, you can look to before and after photos, but another way that you can kind of vet your cosmetic practitioner is through their social media presence. I think someone's social media presence is a good way to get a sense of their personality and are me and this person going to actually vibe? Because you generally want a long-term relationship with your cosmetic provider. They're going to be looking out for you and your face for a while, and you want to make sure that you look forward to those appointments. You feel comfortable asking them questions, and vetting them on social media ahead of time kind of gives you a sense of whether or not your personalities are going to mesh positively. Once you've done a little bit of your online vetting, maybe you've talked to a friend or family member and you've decided, okay, I'm going with this cosmetic practitioner. You make your appointment, and then kind of the final step to really vet them is to have that in-person consultation. That's where you get to ask your questions, see if your personalities align, see if you really just get a vibe that you trust them, you trust their office, and that's when you decide, am I going to go through with these things or not? And either answer is okay. My final little tip that I have, and you don't have to follow this, but I highly recommend it before I get into my red flags, which are important to know as well, is that I encourage you to find a cosmetic practitioner that is relatively close to where you live. Some cosmetic procedures require a follow-up a week or 2 weeks later, and some cosmetic procedures do have the risk of complications. And if you live a state away or a 10-hour drive away from your cosmetic practitioner, it's going to be really hard to have safe, thorough follow-up. That's actually the reason I stopped accepting patients from out of state or out of country. It wasn't allowing me to have the follow-up and to take care of patients the way I want to take care of them. Also, when it comes to cosmetics, there are some serious red flags, so let's talk about those. Number one, I do think you need to watch out for medical spas that have unclear supervision or who are run by non-dermatologists. All medical spas need to have physician supervision, but many times the physician who's overseeing everything isn't even on site. Sometimes they're not even in the same state. I know medical spas can be really enticing. Sometimes the prices are lower, they're more convenient, it's easier to get in, but they need to be able to medically and cosmetically take care of you. Are they taking your medical history into account? Do they know what meds you're on, what your allergies are? Because although side effects from cosmetic treatments are rare, they do happen, and that person needs to be able to keep you safe. Also, there are certain cosmetic procedures that you should not have done if you have certain autoimmune conditions or certain allergies, and if they're not even asking you about those, that's a big problem. A couple other red flags that I have, I mentioned one earlier, if the staff or even the cosmetic practitioner looks overdone, or maybe not overdone, but you just don't like the cosmetic work that they have, maybe you guys aren't going to align. I also think it's a huge red flag if they only carry 1 or 2 devices and they're trying to sell you on it. If they only do microneedling, you can best bet they're going to recommend you microneedling, even though a laser might be a better option for you. I also think you have to keep in mind you're about to have an elective service, and that service starts when you walk in the door. So you need to get a vibe of the office. Is it clean? How are the office staff? Does it feel professional? And ultimately, when you're in your consultation, is the person who's talking to you being overly pushy or telling you things that you need to have done? How does that make you feel? And then my final red flag, and this is so important and it's so easy to overlook because money is a big deal, but if you go to an office and everything seems way cheaper than anywhere else you have seen, that is a huge red flag. Cosmetic services are expensive, and it's not because we're upselling people, it's because Botox, fillers, when you purchase them, they're really expensive. So of course, part of that cost has to be passed on to the patient. And if you're getting super cheap Botox, super cheap fillers, there is a huge chance that they are not being legally purchased and then distributed to you. And that may sound like I'm being dramatic, but that actually happens all the time, even in the United States, even by reputable providers, and it's really scary because it puts your safety at risk. If you're embarking on your cosmetic journey, I hope you found this video helpful. And also, if you have found a cosmetic practitioner that you absolutely love, let us know in the comments what helped you sort of seal the deal. Don't forget to like this video and subscribe to the channel, and I'll see you next time.